Okay, here we are, another episode of Carefor TV, and today we have Shannon Ball from Carefor Hospice in Cornwall. Thank you for joining us, Shannon. Much appreciated.
Of course. Thanks for having me.
Yeah, of course. Even though it says Jane Maxwell on your screen there, you are not Jane Maxwell. So first things first, please introduce yourself in terms of your job, in terms of your role. What do you do at hospice? That kind of stuff. Oh no.
Yeah. So I'm Shannon Ball, and my title here at the hospice is, am I freezing?
A little bit. We'll keep going and see how it goes. Hopefully it'll improve.
Okay. So my title at the hospice is Patient and Family Supportive Services Coordinator. And I would say the main aspect of my job here is to host our bereavement programs that we offer here at hospice. But I find we kind of tap into all of these. So sometimes I help with intake tasks or community programs, and especially any patient or family needs for any of our residents here, as well as our community palliative clients as well.
Okay, cool. So we'll get to that in a second. But first of all, maybe you can give like 100 feet up description of hospice, where it is, how many beds, staff, what you do, like what hospice offers to the community.
Yeah, for sure. So the Carefor Hospice, it's located here in Cornwall, and we are a residential facility. We have 10 beds here to offer end-of-life care to members of the community that are palliative facing end of life. So we run 24/7 facility. We have PSWs, RPNs, RNs here on staff, and as well as myself, who kind of manage more of the program community aspects, as well as Kristen Poirier, who's the program volunteer community supervisor. And so we offer a lot of community programs and kind of follow the patients and families far before they come to hospice for end of life. So it's very holistic for patients and their caregivers as well.
Okay, so maybe talk a little bit about the journey of a family that comes to hospice. Often hospice is considered a place, obviously, where people spend their last days. But yeah, it's not all of a sudden like, somebody shows up at the door and then, they're admitted. You talk about sort of that support that they receive. So maybe a little bit about the journey of somebody, of a family that comes to hospice, what it looks like in the days before, and then what it looks like once they come to hospice. You know what I mean? How that affects the process of allowing their loved one to sort of pass the way that they want them to pass.
Yeah, so ideally, we're involved in the patient and family's experience far before they actually come to hospice for end of life. So we have community clients that have used our services for months or even sometimes a year or more before they actually come for end of life here. Definitely be for us to receive a referral from either a physician, hospital, the LIN, or a self-referral. And at that point, we would send out one of our nurse assessors to go to the patient's home, do an assessment and see what community programs would be suitable, and to just kind of see, are they ready at this point to come in for end of life care? In most cases, they're still at home, they're comfortable at home, and they're able to participate in some of our community programs. So just kind of to assess the needs, such as for caregiver support, if there's any risk of caregiver burnout, any one-on-one support that might be needed from myself for family members or the client themselves. I do a lot of advanced care planning assistance, so helping clients have a power of attorney filled out, or if they need help completing a will. So there's lots of different services that we help with beforehand. And I find that in that case, it's really ideal because a lot of our staff members are able to build that rapport and that relationship with clients and their families,
Mhm.
which makes it a lot less intimidating when they actually come here for end of life care.
So when they do come, I've spoken to some families and they talk about the expectation was that they were going to have a few days with their loved one. And then they end up having, a few weeks and a few months. Like it's not always the case, obviously, but some of the families you talk to, they talk about a shift where I imagine the process of, going through end of life is very stressful, and being able to be at hospice makes things more sort of relaxed. Families become families and not caregivers. The role of the staff in terms of
Yeah.
comfort and support. What is that experience like for not only the residents, but also for the families once they move into hospice?
Yeah, I think you described it very well. I think that's one of the most important aspects when someone's admitted here. Um, Beforehand, there's often so much stress, especially on the caregiver's end, of just trying to make sure that they're comfortable, making sure their loved one's needs are met. So when they are admitted here, it's people often describe it as they just have like a breath of relief once they come in the door. The environment is so welcoming here. All of the staff are great here. And it really gives them a chance to just focus on spending time with their loved one and not have to be concerned about whether their loved one's comfortable. We definitely take care of that and just allow them to focus on spending that quality time with their loved one. And like you said too, in more cases than not, it's not just a few days that they're here with us. It's oftentimes a few weeks, even, over a month or so. So they get to really catch up on spending that quality time with their loved one.
Awesome. So the bereavement program. So obviously, the idea is that you're there to support the person who's, dying, but the bereavement program is obviously in support of the family. Can you talk a little bit more about what that looks like and how you support families? You're a little frozen.
Yeah,
There you go.
I think when it comes to bereavement support, I'm frozen.
No, you're back. You're good. You're good.
Okay. So when it comes to bereavement support, I find that the most important component is for us to actually reach out to the family. It's really intimidating sometimes for the client to actually reach out to receive that support. So it's kind of an automatic process when someone passes away here. I reach out to the family after the death takes place. And that's not just the case with people that pass away here, but anybody that's on our community list that may not have ended up here for end of life, we make sure to reach out to them as well to offer those bereavement services. And a lot of the time too, I get referrals from the community, that weren't connected to hospice at all, but they're grieving, and
Oh, yeah.
there's not a lot of grief support right now. So we're really filling a gap in the community for that. So yeah, we right now for bereavement, we have a few different programs. So I do a lot of one-on-one support. We have a support group that right now we're having it outdoors, but we're able to have it in person now, which is really nice. And we're also doing a 6-week closed bereavement group right now as well, which is a little bit more focused on grief education, but also peer support too.
Okay. That's awesome. Do you find that palliative care is evolving? I mean, I think of like the virtual reality goggles and things like that I've sort of witnessed. Do you find that the process of learning about dying, the community conversations around dying, are we becoming more comfortable with those conversations? Or, it's always something in our culture that has been just like grieve quietly, don't talk about it. Do you feel like, I mean, and I don't know if COVID has anything to do with it, or if just a community is kind of like growing. Do you feel like there's a change that's been taking place in your time?
I would definitely say yes, and I do think COVID has had a big impact on that as well. I think especially towards the beginning of COVID, supports were kind of lacking, especially in-person supports. And family members especially wanted to reach out and have information beforehand, really planning to have things set up in place and know about our services beforehand. So I would definitely say so. And we're always virtual reality, I think, is a really important one, especially when patients were very limited to staying in their rooms. So to have that virtual reality component for them to be able to put on a headset and go outdoors, take a traveling trip to anywhere in the world,
Yeah.
and have their caregivers bond with them over that experience too, has been, I think, really important for us here.
Yeah, awesome. Last question. Hospice is one of the programs that really benefits from donations, from fundraising. And there's a community, that there's a certain amount of money that comes from the government, but a tremendous, part of the money that's required to operate hospice comes from the community. And there's a community around hospice in terms of donors and volunteers. Is there something that you think inspires that community, that creates that sort of group of people that will show up to Hike for Hospice, that will donate to the ride, that will give to the telethon, all that kind of stuff?
I absolutely think so, and it's so nice to see the value that the community puts on hospice and end of life care. I think it's such a crucial, important service that every have. And I think having a loved one come to hospice and just that word of mouth, people spreading about the care that their loved one received, that goes a long way with people wanting to help make sure that we can continue offering these services. And everyone's so generous. I think, especially end of life care, that's something that every single person is going to have to go through at some point with their loved ones, with themselves. And
Yeah.
for that reason, it's such a universal service that's so important.
Yeah, true. All right. Thanks, Shannon. Much appreciated. If anybody has any questions, I assume they can contact you, sball@carefor.ca. Say hi to Jane Maxwell for us. All right. Thanks.